The HoverJack Air Patient Lift is used in the event of a patient fall to gently lift your patient in a supine position from the ground back up to bed or stretcher height. This segment will train you on the proper use of the HoverJack Air Patient Lift, including how to log roll the patient onto the HoverJack lift and HoverMat transfer mattress. Use a HoverMat transfer mattress to transfer onto a deflated HoverJack lift. Inflate the HoverJack Air Patient Lift. Transfer from an inflated HoverJack lift to a bed using the HoverMat Air Transfer System. To ensure that each chamber of the HoverJack is fully inflated, we will explain the look, listen, and feel technique. This segment will show the use of the HoverMat Air Transfer System and air supply. Please review the video titled Using the HoverMat Air Transfer System and HoverTech Air Supply for detailed instructions on these devices before using the HoverMat Air Transfer Mattress and HoverTech Air Supply. The HoverJack Air Patient Lift system includes the HoverJack Patient Lift and the HoverTech Air Supply. The same air supply you would use for the HoverMat Transfer Mattress is also used to inflate the HoverJack to raise the patient off of the floor. The HoverJack Air Patient Lift has 4 inflation chambers. Each one has a black one-way valve through which the air supply inflates the chamber. The valves are labeled and numbered from 1 to 4, with the chamber labeled Valve 1 being the closest to the floor. Each chamber also has a red-capped valve to be used for quick deflation. Always recap these valves after using the HoverJack to ensure they are closed for the next use. It is not necessary to cap the black valves unless the patient will remain on the inflated HoverJack for an extended period of time. The HoverJack has 8 perimeter handles, 2 at the foot end, 2 at the head end, and 2 on each side. There are 2 patient safety straps, and a pull strap is located at the head end. To clean the HoverJack, wipe it down after each use with the same cleaners or solutions your facility uses to clean stretcher pads and mattresses. It is important to note that the HoverJack cannot be machine laundered. To ensure that your HoverJack is easily accessible, HoverTech offers a wheeled storage and transport cart. The HoverJack can be stored in the larger bottom basket, while the air supply and HoverMat are kept in the upper basket. In response to a patient fall, the HoverJack cart can be rolled to the site of the fall, and the HoverJack can be easily pulled from the cart and positioned on the floor. There are 2 methods that can be used to position a patient on the HoverJack. With either method, at least 2 caregivers must be present to perform a patient lift using the HoverJack. One option is to log roll the patient onto the HoverJack. To do so, place the HoverJack as close to the patient's body as possible. If a HoverMat is available, place it on top of the HoverJack so both can be positioned under the patient simultaneously. The HoverMat will be used to perform the lateral transfer onto a bed or stretcher once the patient has been lifted. Log roll the patient onto the deflated HoverJack, making certain that the patient's body is centered on the device. If the patient has fallen in a hard-to-reach place such as the bathroom, the HoverMat may be used to extract the patient from the space and to move him or her onto the deflated HoverJack. Secure as much of the HoverMat under your patient as possible with a log rolling technique. Inflate the HoverMat and move your patient from the fall site onto the deflated HoverJack. Glide the inflated HoverMat at an angle over the long edge of the deflated HoverJack. Make sure that the patient's head is below the head end seam of the HoverJack and that the patient's body is centered. Deflate the HoverMat and disconnect the air supply hose from the HoverMat. Once the patient is positioned on the deflated HoverJack using either of the described methods, you can begin the inflation process. One caregiver should be positioned near the patient's head to reassure the patient and monitor the lift, while the other caregiver remains at the foot end to inflate the HoverJack. The HoverMat and HoverJack patient safety straps should be attached loosely around the patient. The safety straps will become tighter when the topmost chamber is filled. Check that the red-capped valves are fully closed. The inflation valve should not be capped. Check that the black Teflon-coated bottom side of the HoverJack is against the floor. Explain the inflation process to the patient. Begin inflating the HoverJack by placing the air supply hose over the inflation valve located on the air chamber against the floor, labeled Valve 1. Press the HoverJack button on the air supply to initiate airflow and begin inflation. To ensure that each HoverJack air chamber is fully inflated, remember to look, listen, and feel. Watch the chamber inflate. The patient's body will stop rising when the chamber is fully inflated. The sound of the air will change to a higher pitch once the chamber is fully inflated. The chamber should feel rock hard to the touch. When you have determined that the first chamber is fully inflated, move the air hose to the valve in the second chamber, labeled Valve 2, and repeat the look, listen, and feel technique until fully inflated. Continue the same process for air chamber valves labeled 3 and 4. It is important that each chamber is inflated in sequence for safety, starting with the chamber valve 1, which is closest to the floor. If chambers are inflated out of order, the HoverJack can become unstable. Once all chambers are fully inflated, press the standby button on the air supply to turn off the airflow. Bring a bed or stretcher alongside the inflated HoverJack, or use the perimeter handles to slide the HoverJack next to the bed or stretcher, onto which the patient will be laterally transferred. Because the HoverJack has a Teflon-coated bottom, you can easily transport the patient across the floor. Adjust the bed height prior to the patient transfer so that it is slightly lower than the top of the inflated HoverJack, if possible. Detach the HoverJack safety straps and insert the air supply hose into the HoverMat hose entry flap closest to the receiving surface. The caregiver at the head end will move to the side of the HoverJack, assume the position of safety, advise the patient of inflation, and ask the caregiver at the foot end to inflate the HoverMat. The caregiver at the patient's side will keep his or her body firmly against the inflated HoverJack during the lateral patient transfer to avoid any HoverJack movement. The same caregiver will then initiate the patient transfer by gently pushing the inflated HoverMat at an angle toward the receiving caregiver, who has moved into position on the opposite side of the bed or stretcher.